Hello and welcome to part 1 of the Coordinated Entry System training. This training is the first of 3 coordinated entry trainings designed to help housing provider staff, outreach workers, and other community stakeholders better understand how the coordinated entry system operates to best serve persons experiencing homelessness. This training will give an overview of the Memphis and Shelby County Continuum of Care, also known as the COC lead agency structure, the coordinated entry system, housing programs within the COC, and an overview of the data system used within the COC called the Homeless Management Information System, or HMIS. The COC is designed to bring together a wide variety of community stakeholders and housing staff to help formulate plans for ending homelessness in the community, prioritize resources, and help manage federal funding for HUD-funded homeless housing programs. The COC is designated by HUD to carry out responsibilities outlined in the HEART Act relating to planning and operating a COC for persons experiencing homelessness, operating and upkeeping a homeless management information system, and designing and implementing the process for applying for COC program funds. In Memphis and Shelby County, the COC is named the Memphis and Shelby County Homeless Consortium. This body is composed of a variety of providers, which range from housing providers to community advocates to mental health providers and more. The consortium has a governing council, which serves as the decision-making body of the COC and works alongside the COC lead agency and HMIS lead agency, along with members of the consortium, to implement strategies and plans to end homelessness. The COC lead agency is the agency designated by the COC to provide planning, technical assistance, and service coordinations to agencies working to end homelessness in Memphis and Shelby County. Currently, Community Alliance for the Homeless serves as the COC lead agency and also serves as the HMIS lead agency and leads the individual's coordinated entry system. The purpose of the coordinated entry system is to prioritize the most vulnerable people who are in need of housing or services instead of serving people on a first-come, first-served basis to make sure that limited resources are saved for those most in need. The coordinated entry system must have established access points and use a standardized assessment process to gather information on people's needs, preferences, and the barriers they may face in regaining housing. Once the assessment has identified the most vulnerable people with the highest need, the COC follows established policies and procedures to prioritize households for referrals to appropriate and available housing and supportive service resources, also called projects. This graphic outlines the 4 main stages of the coordinated entry system, which includes access points, assessments, prioritization, and referrals. HUD mandates that COCs operate an effective coordinated entry system and has strict standards that must be upheld by communities. The Memphis and Shelby County Coordinated Entry System is structured based on the guidance and policies provided by HUD. The Coordinated Entry System is broken into 2 sections, one focusing on individuals and unaccompanied youth, and the other side focusing on families, which are defined as at least 1 adult and 1 minor child. The individual's coordinated entry system has a no wrong door approach for access points, which means that clients can access coordinated entry through any agency or provider that is within the COC and/or through engaging with outreach workers. On the family side, MIFA, or the Metropolitan Interfaith Association, serves as the central access point for all families experiencing homelessness. MIFA helps to coordinate mediation efforts, shelter referrals, and provide housing assistance for families who qualify for housing programs. To prioritize persons experiencing homelessness based on vulnerability, standard assessment tools created by ORGCode are used by our COC. There are 3 types of assessments based on population types. The Vulnerability Index Service Prioritization Decision Assistance Tool, or the VI-SPDAT, is used for individuals over 25. The Transitional Age Youth, or TAY VI-SPDAT, is used for unaccompanied youth ages 18 to 24. And the Families VI-SPDAT is used for households with at least one minor child. These assessments ask a variety of questions, including if a person has income, their risk of violence or victimization, their mental health, physical disability, and more, to give a numeric score of person's vulnerability, which makes it easier to rank them based on their vulnerability. If a client receives a score of 0 to 3, they are not recommended for COC housing programs, but can receive mediation or diversion services. Clients scoring 4 through 7 are eligible for rapid rehousing, while clients who score 8 and up are eligible for permanent supportive housing. The two main housing programs clients are able to access through the Coordinated Entry System include Rapid Rehousing, or RRH, and Permanent Supportive Housing, or PSH. Permanent supportive housing programs provide clients with housing and supportive services such as case management for the extent of their program stay, which has no time limit and is prioritized for those who are highly vulnerable. Rapid rehousing is used for those who are in need of short-term assistance to get back on their feet, and clients receive short-term financial support, such as assistance with security deposits or rental assistance, and case management for up to 1 year. The by name list is used on the individual's coordinated entry side and serves as an active waiting list when housing programs are not immediately available. This list is updated on an ongoing basis by the Coordinated Entry lead agency staff from updates by Coordinated Entry direct service staff providers, is sorted by vulnerability scores, and allows the community to move people higher on the list based on a client's level of vulnerability, such as additional health issues or the level of disability. This also functions as an active waiting list when housing programs do not have immediate spots open, such as a unit within the housing program that would be available for a client to be referred to. To review changes, updates, and referrals made from the by name list, bi-weekly meetings are held with outreach workers, housing providers, and additional community players. These meetings allow for community collaboration and case conferencing, are facilitated by CE lead agency staff, and help keep providers and staff up to date on housing openings, client status, and client need or potential changes. HMIS is the database that collects and stores client information for those in coordinated entry, COC-funded housing programs, and those who have accessed certain shelters. HMIS allows service providers to securely share client information for the purpose of getting clients into safe and stable housing. HUD has strict standards for data security and data privacy for clients within COC-funded programs and other homeless programs that send data to the COC. Because of this, the HMIS lead agency works to ensure data standards are met within the COC, which helps to better understand homelessness in Memphis and Shelby County. Coordinated Entry utilizes HMIS to help manage referrals, client data, and allows for increased collaboration. The CE lead agency facilitates the referrals to programs in HMIS, and outreach workers and COC-funded program staff are able to upload program documentation, VI assessments, and other client data to help facilitate with referrals. With that, we have reached the end of Coordinated Entry Training Part 1. For more information, or if you have additional questions, please feel free to reach out to the CE lead agency at coordinatedentry@caf.org.